Today we're going to talk about Chapter 9, Maternal and Fetal Nutrition. Key components of nutritional care. You'll do a nutritional assessment, diagnosis of nutritional related problems or risk factors for the pregnant mom, interventional based on individual's dietary goals and plan for appropriate weight gain, evaluation with referral to a nutritionist or dietitian as necessary for the pregnant mother. Nutrition is one of many factors influencing the outcome of pregnancy. Maternal nutrition before and during pregnancy is an important preventative measure. Nutrition affects both birth weight. Poor nutrition can cause low birth weight, preterm infants, and the long-term health of the child. We need to also consider things that may affect mothers at risk. Diabetes, PKU, and obesity. PKU is fetal ketonuria. It's a rare inherited disorder that causes an amino acid called phenylalanine to build up in your body. PKU is caused by a defect in a gene that helps create the enzyme needed to break down phenylalanine, and people with this need to limit their intake of protein. Nurses need to assist in the nutrition of the expectant mother by evaluation, education, and referrals if necessary to the appropriate dietary supplements and the dietitian. This is a chart that gives some factors that influence the outcome of pregnancy. If you look at the chart, it just points to different things such as socioeconomic status, income levels, health status, physical, psychological, emotional, self-care, family size, composition, stability of the family, education, knowledge, skills, nutrition, dietary, adequate food supplies, personal genetics, culture, and the home environment. Nutrient needs before conception. The first trimester, it is very crucial for embryonic and fetal organ development to receive specific nutrients. Healthful diet before conception ensures that adequate nutrients are available for the developing fetus. Folate and folic acid intake are very important in the preconceptual period. Neural tube defects are more common in infants to women with poor folic acid intake. The proper diet for the expectant mother should start before conception. Folic acid are very important to the developing fetus to avoid neural tube defects. Proper closure of the neural tube is required for normal formation of the spinal cord. Examples of foods high in folic acid are your dark leafy green vegetables. Some of these are asparagus, broccoli, citrus fruits, beans, peas and lentils, avocados, okra, and Brussels sprouts. Nutrient needs during pregnancies. There are factors that contribute to increase in nutrient needs. The uterine and placental fetal unit, maternal blood volume that increases during pregnancy, the maternal mammary development during pregnancy, and your metabolics that increase during pregnancy all contribute to the increase in the nutrient needs during pregnancy. If you look at page 228 in your textbook, you can find more information about this. Remember, mom's blood volume increases by 40 to 50% during pregnancy. Mom's metabolic needs are increased due to the needs of the placentals, the fetus, mom, and her calorie increase about approximately 300 calories a day. When talking about weight gain during a pregnancy, we always want to consider energy needs. We always want to consider mom's pre-pregnancy weight, and we don't want to restrict her weight. We don't want to talk about dieting during pregnancy. The desirable weight gain during pregnancy varies among women. The primary factor to consider in making a weight gain recommendation is the appropriateness of the pregnancy weight for the woman's height and whether the woman's weight was normal before pregnancy or whether she was underweight or overweight. These are things we want to consider. Was the mother properly cared for and was her weight normal prior to pregnancy? Severely underweight women are at risk for preterm labor and low birth weight babies. You can find more of this information in your textbook on page 231. This picture depicts an underweight mom and an underweight baby, or a low birth weight baby. This is an example of a nutritional chart during pregnancy. Now we want to discuss a woman who may gain more weight than normal for her body size. She may have an increased incidence of fetal pelvic disproportion, operative vaginal birth, emergency cesarean birth, postpartum hemorrhage, more risk of infection, late fetal death, preeclampsia, and gestational diabetes. You can see more of this information in your textbook on page 231. The recommended weight gain during pregnancy is determined largely by the woman's pre-pregnancy weight. I've listed a chart that shows your recommended weight gain based on if you were underweight, normal weight, or overweight, or obese pre-pregnancy. You can find this information listed on page 231, box 9-2 in your textbook. Let's talk about minerals and vitamins. Iron is needed for adequate red blood cell formation. Calcium, typically there's not an increase required. Some adult women do not consume milk or milk products daily, so this results in inadequate intake of calcium. Some cultures are known to be lactose intolerant, and therefore they do not take in milk or milk products. It is known that Asians, African Americans, Native Americans, and Alaska Natives, this is sometimes in their cultures. Some cultures do not drink milk as adults, Puerto Ricans and other Hispanic cultures. This information is found in your textbook on page 237. Be aware of bone meal used as a calcium source. It does contain lead, and this will cross the placenta. Now when talking about minerals and vitamins, you have your fat-soluble vitamins and your water-soluble vitamins. Your fat-soluble vitamins, A, D, E, and K, can generally be consumed without a problem. These are your green, leafy, and yellow vegetables. Your water-soluble vitamins, your folate and folic acid, your B6, vitamin C, and B12 also can generally be consumed. You need to have a food-rich diet in grains, white breads, flour, and pasta. Other nutritional issues during pregnancy, sometimes women will crave non-food items, and this is an incidence known as pica, the practice of consuming non-food substances. They might crave dirt, clay, or even detergent. This may be influenced by the woman's cultural background. Sometimes it's an innate drive to consume nutrients missing from their diet. You can find more information about this as well in your textbook on page 239. Adolescent pregnancy needs. We want to improve the nutritional health of the pregnant adolescent by focusing on the knowledge and planning of their meals. Nutrition interventions and educational programs effective with adolescents. We want to meet their needs, but also enhance their meal planning. Understanding the factors that create barriers to change in adolescent population, and promote access to prenatal care for the adolescent teen who may be pregnant. Other issues during pregnancy, preeclampsia, the cause is still unknown. Speculation that poor intake of specific nutrients could be a contributing factor. However, like I stated, the cause is still unknown. An adequate diet remains the best means of prevention and early detection of any difficulty with blood pressure. So just know that we don't know a cause, and the woman just needs to have an adequate diet and early intervention. Click on the link provided and watch the video. It talks about a healthy diet during pregnancy. Specifically note how you would educate a mom about a healthy diet during pregnancy, what fishes she should avoid during her diet, what fish she would not be able to eat during pregnancy that can cause infection, and what foods do we want to avoid during pregnancy that could harbor listeria. Those are things you want to note during the video and be aware of. Physical activity during pregnancy. Moderate exercise yields many benefits, including improving their muscle tone, shortening the course of labor, improving their outcomes after they give birth, and a sense of well-being. Liberal amounts of fluids should be consumed before, during, and after exercise, and calorie intake sufficient to meet the needs of the pregnant mom so that she can exercise. As with anything, you should get approved by your treating physician and make sure this is something that's okay for this pregnant mom. Typically, if the mom has been exercising prior to pregnancy, she shouldn't have any problems exercising during pregnancy. But again, this needs to be approved by her treating physician. Nutritional needs during lactation should be similar to those during pregnancy. Needs for energy, calories, protein, calcium, iodine, zinc, the B vitamins, vitamin C remain greater than non-pregnant needs. Calorie needs are based on a recommended pattern of gain. As I said before, it depends on mom's pre-pregnancy weight, typically. See page 231, table 9.2. An additional 340 kcal per day, second trimester, and 460 kcal per day, third trimester, typically. Please, again, see page 231, table 9.2 for this information. There's an average increased calorie intake around 300 calories daily based on your pre-pregnancy size. Energy intake increase of 340 kcal more than the woman's non-pregnant intake is recommended. Increased maternal weight loss may be expected during lactation. Smoking, alcohol intake, and excessive caffeine intake should be avoided during lactation. Let's discuss diet history and obstetric and gynecological effects on nutrition. Nutritional reserves and multiparous women may be depleted. A history of SGA may indicate poor nutritional intake. LGA may indicate maternal diabetes. Health history, any chronic illnesses, usual maternal diet, adequacy of income to facilitate diet needs when you're pregnant. Physical examination is very important. Anthropometric measurements, those are body measurements. Laboratory testing, H&H to screen for anemia. All this information is in your textbook on page 240 and 241. We need to adequately prepare the mother and educate her about her dietary intake. During pregnancy, postpartum, we want to talk to her about avoiding smoking and alcohol consumption. Medical nutrition therapy. For adolescents under the age of 25, they need 3 to 4 servings of milk daily. Counseling about iron supplementation and preterm birth. Listeria and bacteria, there's an increased risk of miscarriages and stillbirth, so we need to talk to them about foods that are containing unpasteurized milk, processed meats, soft cheeses such as queso. We need to talk to them about the high risk of bacteria and listeria in those types of foods. Coping with nutritional related discomforts of pregnancy. Nausea and vomiting can always be a problem for moms. There are some pregnant mothers who never have a problem with this, and others who have horrible issues with nausea and vomiting. Hyperemesis gravidarum can pose a very serious health problem. It can be dangerous to the fetus. So if you have a mother who's experiencing excessive nausea and vomiting, she needs to be educated on contacting her physician and not letting this pass and go by, because it can be a very serious problem. You can read about hyperemesis gravidarum in your textbooks. Please see page 245 where it starts talking about nausea and vomiting. Constipation, the mom needs to take a diet high in fiber and fluids. Heartburn, small frequent meals and avoiding spicy foods will help alleviate this. Cultural influences. Nurses should be aware of these needs when giving dietary advice, because different cultures allow different foods into their diet. Most people can stay within their cultural dietary preferences with modifications during their pregnancy. And vegetarian diets can be difficult for a pregnant mother. We need to make sure that there are modifications made with supplements so that she gets her the vitamin B12 and the nutrients that she needs. This particular slide just talks about cultural differences in a diet, and you can read through it and just give some thought to different diets culturally and how would you modify the diet for the pregnant mother.